Today in Health IT, we have another interview from the Chime Fall Forum. And what we did was a set of interviews in action, which we are really excited about. And I'm looking forward to sharing with you. My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Again, as I said, got a great opportunity to go to San Diego, visit with some CIOs and the people that make the magic happen in healthcare and healthcare IT. And here's another one of these great interviews. All right, so here we are from the Chime floor with another interview. We are with Vishaka Sant with ServiceNow. What's your role?
I am the global head of healthcare at ServiceNow. So they brought me in to really figure out where should ServiceNow focus from a strategy, a market, a product perspective as we look at increasing our footprint in the healthcare and life sciences industry.
So when people hear ServiceNow, it's called This Week in Health IT is the show, they're thinking ITSM.
That's right.
But you're looking at a lot more than that.
Yeah, we are looking at the growth that actually can connect workflows across internal people, external customers, and all of the devices that are really needed to help provide care that is much more coordinated and efficient and optimized, and taking that from finance to project management to ITSM to healthcare. That messaging and that pivot is what we're trying to do for healthcare at ServiceNow.
So when people think about ServiceNow, they shouldn't be thinking ITSM? Because that's, from a technology perspective, that's what I think. I should be thinking, what, workflow? Orchestrating workflows?
That's right. Yeah, I would say that it's truly a workflow orchestration engine that could be applied in any scenario, whether it's IT. So IT service management is what we use for IT, and all of procurement. We have procurement services, right? And so, what I would really encourage is people start looking at ServiceNow in terms of, how do you define workflow based on the challenge that you actually have? What problem are you trying to solve, irrespective of the product that's going to help enable you to move past the challenges? What are the challenges, and then how can we leverage a digital health platform to solve for those gray areas in between an EMR, in between a billing system, that still need to be connected in order to provide this notion of consumerism and maintaining, understanding patient expectations and providing products that are intelligent, so everyone's time is being saved at the end of the day.
So it's one of the things we do in healthcare as a former CIO. One of the things we do is we overlap technologies all over the place. And it's interesting because as you're sort of saying this, I'm thinking through, we're probably out looking at a very specific solution that does this, fills this gap between the EMR and communication with the consumer, communication with the clinicians across various practices and whatnot. But when I hear you talking, I'm sitting there going, maybe we should look at our investment in ServiceNow, because potentially we could orchestrate those workflows with a tool that we already own.
With a platform that we already own. And the beauty of the platform is that it connects to other offerings within ServiceNow because it's all a part of the platform. And when you layer onto it a data model like we've done with healthcare and life sciences service management, you are now opening yourself up to additional workflows in a very concentrated area. So for example, in healthcare, discharge management, yes, we have vendors that do it, but then there's also, perhaps the discharge is going to lead to transitions to care at home. What does the workflow look like for clinicians to now know we need to service this patient who's going to do home-based dialysis? How does the dialysis machine get there? How do you coordinate the patient being ready to get on a recurring basis and actually schedule the visits that are needed from a clinician to go into the house to help you administer it, to teach you, to train you? And all of that is really a workflow applied in a very specific use case in healthcare.
Right.
And so when the biggest challenge and benefit that we have is really describing this word workflow. And if I could have people who are listening in understand that ServiceNow is now getting into, and we have been, it's just, what problem are you trying to solve that
So
enables a workflow.
as a platform, are you connecting into EHR data and connecting into all these various systems that we have for communication?
Yeah, so we have the ability to actually ingest data. We're based on the HL7 Fire standards, and with our data model, we are able to listen to APIs, get interfaces built in, and so we do have spokes that connect to various EMRs.
Wow. So you use the word platform, and I love the word platform because it means flexibility. Did you see the platform get utilized through the pandemic in different ways that maybe people had envisioned?
Yeah, so through the pandemic, I was actually working for Kaiser Permanente. So I have background in the healthcare industries and have just recently joined ServiceNow. But as far as the use of the platform, the uptick in terms of virtual health, the uptick in terms of creative ways to service people, right? Grocery stores went to go to this lane, you'll get all your groceries. And we will never walk away from that. Now everything needs to be at the convenience of the consumer, at the right time, right place, right data, and right security. And the benefit of our platform is that we have all of those kind of built in, and it's this notion of a composable architecture. It's modular. So we're not, if you have great, security operations, it's not something that's built in so heavy. It's a modular piece. Same thing with healthcare and life sciences, right? It's modular, and we're wanting it to be low code, no code, so that people who are closest to the work, that know where the inefficiencies are, aren't bogged down with the development required to make a change. It's much more of a drag drop type of method, and I think that that's one of the simplicity, because everything is on the platform.
Right.
You're not having to go down the street to your cousin to figure out what's on that platform and then try to integrate.
So you're at the Chime conference.
Yeah.
What's going to be your takeaways from this conference? We're having some interesting conversations. It's great to be with people again and have these conversations.
Yeah.
But what are some of the takeaways? What are health systems, what are they challenged with? What are they looking to try to solve that they're talking to you about?
Yeah, I think if I look at it from a sheer workforce perspective, how do we do more with less resources now? And that could be clinicians, that could be financials, that could be, grants, etc. We're trying to understand nursing shortages. Are there ways for us to augment, administrative things that they don't need to do in the first place?
Right.
So that they can focus on the patient, which every hospital ER is, suffering right now.
Right.
And so the takeaway here is, how can we help augment some of the repetitive that lives everywhere in our life that doesn't require somebody to necessarily focus on it, and it just becomes more intelligent.
Right.
The other thing is sensors and this notion of care at home. It's a mixed bag out there. I think healthcare organizations want to get there, and the ones that have the resources available are on the path there, but there's still a little bit of a hold my hand, because I'm not sure even how to start that dialogue and to understand what it's going to take to establish a care at home system for. And so if as a healthcare industry we are moving towards affordability, and we see that we're going to need to get more out of the core care sites so that it's cheaper, faster, better, using the best resources and not impacting outcomes. If we're able to get to that, and I think that ServiceNow has a role in order to help us get there through the workflow automation of these redundant tasks, so that people can focus on their core strengths, which will allow us to have better outcomes with the patients, which will allow us to be a less cost healthcare society.
Yep, absolutely. I want to thank you for your time.
Thank you.
There you have it. Hope you enjoyed it. We did 10 of these interviews at the Chime Fall Forum. Hope you check back for some of those other interviews to catch what the industry insiders are saying about healthcare IT.